as you all might have suspected, I'm not Kelly Nielsen. Glad that Kelly was able to clear up that confusion quickly because you might not be getting the best messenger, but I promise to do my best, and I also appreciate your grace in stepping in for Kelly. I am Ashley Carroll. I'm the Healthy Communities Coordinator here at CHI Health. And thank you for the opportunity to give you a quick update on our community benefit work. Okay, so we take very seriously our place as an anchor institution in the communities that we serve. We have 14 hospitals, 2 standalone behavioral health facilities, and more than 150 employed physician practice locations in Nebraska and Southwest Iowa. We also recently acquired North Dakota into our region and merged earlier this year with Dignity Health to form Comm and Spirit Health. Why that's important, beyond being accessible now and being able to provide healthcare to nearly 1 in 4 consumers in the U.S., is really that this reflects and our transformative strategies for our organization, our combined entity. And what you'll note there is an emphasis on advocating for healthy populations and addressing the unique needs of those we serve. So it's great to see that while this is the spirit of our community benefit work, it's also reflected at our national level, and that's a commitment to our communities and everywhere that we are and where we're serving. So in FY19, we provided a total of $185 million in total community benefit. That includes 110,031 people who were receiving Medicaid at a cost of $85.2 million. An additional 166,878 folks we covered through our medical financial assistance program to the tune of $60.4 million, and countless families that we served through our broader community health programs at an investment of $39.4 million. That was our system total community benefit contribution. This is reflective of our Omaha Metro community benefit. So in FY19, we provided a total of $121.9 million. That represents 144,164 individuals that we served through our medical financial assistance program, and then the pie chart shows you the breakdown of that community benefit investment. So you'll see the largest share is our unpaid cost of Medicaid, $53.1 million. Our charity care is in green, a third of the total budget, and then nearly a quarter, or 23%, was invested through broader community health to the tune of $28.1 million. And just responding to the previous presentations last month by our colleagues at Methodist and Children's, we can entertain some more substantive conversation at the end of this presentation related to Medicaid expansion, but just wanted to re-emphasize that we're very supportive of Medicaid expansion. We're eagerly awaiting its implementation because, as you can see, there's clearly such a need here. Last year, over 9% of our operating revenue in the Omaha Metro went to community benefit, and that does not include bad debt or unpaid cost of Medicare. Although we see shifts between charity care and Medicaid on an ongoing basis, we've seen fairly steady numbers receiving uncompensated care over the last 5+ years, around $60,000 to $65,000. So this is an overview across our system of our implementation strategy plan, or our hospital plan priorities over this next 3-year cycle, FY20 through 22. And what you'll note here, as we evolve this process, is I would hope that you take away from this that there is a growing recognition and a need to move further upstream. So you'll see less hospitals prioritizing things like chronic disease as we have in previous plans, and more hospitals focusing on behavioral health, social determinants of health, and access to care, which I'll get into in just a little bit. So this is across our system, and then here within the Omaha Metro, this is inclusive of all of our Omaha hospitals. They are working on a joint plan, leveraging strengths and resources across our hospitals. And we've prioritized the following 3 priorities: behavioral health, social determinants of health, and violence prevention. And you can see a quick definition of how we've defined each of those in those dot points. Behavioral health, of course, I will not be able to do this justice given the time frame and wanting to be respectful of my colleagues' time as well. So I just wanted to call out a couple of these things in the slides that follow. But this is a summary of our behavioral health strategies on our hospital plan. And this is our scope of behavioral health services across the region. The takeaway here really is just that we are striving to provide access to the appropriate level of behavioral health services to individuals and families when they need it, where they need it. While much of this is not community benefit per se, we're proud of the commitment we've made to behavioral health services in addition to the community benefit work that's specifically focused on mental health and substance abuse. In fact, behavioral health is one of our 6 key strategic service lines. This is just a point-in-time count of the individuals that we serve through all of those behavioral health services that I listed on the previous slide. So we're serving about 25,367 patients through, whether that's inpatient, partial residential, outpatient clinic, telehealth, and all of those services. You can also see on that pie chart a breakdown of our population demographic by age group. So the largest share, of course, is our adult population, but over a quarter of the patients that we serve are child and adolescents, and we also have a significant geriatric population as well. So one of the ways in which we are providing community benefit with regard to behavioral health is staffing 24/7 access and referral line known as 717 HOPE. This is really the front door and the way in which individuals and families in need can get connected to the appropriate level of resource. And we're seeing over 5,000 calls a month to 717 HOPE. We are, in an effort to continue our focus on early intervention and bolstering youth and families, we are committed to making our dream of the Mental Health Center for Children and Families, which would be located on the Emmanuel campus, a reality. We are diligently working on fundraising efforts and really think that this is a desperate need in our community to focus on prevention, education, and research, really a space for community-based care and partnerships, and extending that clinical care continuum. We hear continually that folks don't know how to navigate the system, that it's very challenging, and this is, the intention of this is to provide that one-stop shop. I also wanted to just mention, as many of you in the room are aware and are actively involved in the Build Health Challenge. We're delighted to be working with so many of you, bringing the self-healing communities model to North Omaha. This is really the dream and the brainchild and the fruit of much hard work on the part of Heartland Family Service. And we are now among 55 communities around the country who have committed to bold, upstream, integrated, local and data-driven solutions. We're flipping the traditional model on its head, putting residents in the driver's seat so they can best identify those underlying drivers of poor mental health, and they can identify and implement the appropriate sustainable solutions. Really excited about this and would look forward to updating you on this progress in the future. Also wanted to mention our partnership with Nebraska Alzheimer's Association. Similarly, this is in response to, again, what can be a really devastating and puzzling diagnosis for patients, but also the whole families involved. And so this is supporting their care consultation program. This is a free resource available to anyone who can call and just start to understand what is this journey going to look like for us? What are those community resources that are available to me? And so we're working within our system. Not only are we providing financial support to that program, but we're also working within the system to make sure that all of our physicians are aware of this resource and are putting this tool in the hands of our patients. I'm going to switch gears here a little bit and talk just briefly about our social determinants of health and how we define that. Is around 3 key areas of focus: healthy food access, housing, and poverty and workforce development. So one thing I wanted to call to your attention is the issue of homelessness and lack of affordable housing is very much on our radar. We launched a partnership with Together in 2017 to provide housing case management for our ED patients at University Campus located at 24th and Cumming Street. We recently expanded that initiative to all inpatient floors at CUMC Bergen. This is hot off the press, just started in October, so we're just about 2 months in, and what we're seeing is some really encouraging preliminary results. Currently, since our pilot started in October, we're seeing about 7 referrals a week going to a dedicated Together staff member who's on site at CUMC Bergen about 10 hours a week to qualify eligibility, to build relationships with the patient and with our clinical care team, and then triage those needs appropriately. Since that time, as of November 19th, 51 patients had been referred, 22 had consented to enroll in their case management program, and 9 have been successfully discharged into housing in just about a month and a half time. We're also continuing to invest in the Bridges Out of Poverty program in Omaha and Council Bluffs. This really works with low-income individuals on bolstering their skills around financial literacy and giving them the tools to be financially self-sustainable. And we're seeing great results here. On average, graduates increase their net monthly cash flow by more than $1,500 per month within just 3 to 12 months after graduation. Within food access, there's a lot of work that I can't go into at depth at this present moment, but I just wanted to talk a little bit about Double Up Food Bucks. We are continuing to support the program with an equal match with Children's Hospital and Medical Center. This is doubling the purchasing power of fresh fruits and vegetables within our downtown Omaha and Exarban Farmers Market here in the Omaha Metro. We also just recently added 2 retail sites, so this is year-round at No More Empty Pots and at Las Minas in South Omaha. And this has also been a priority that's been lifted up out of the Share Our Table Food Security Group. So we have our sights set on expanding the number of sites within the Omaha Metro that are participating in this SNAP incentive program. We know from FY19 that about between Omaha and Lincoln, there were 908 unique Double Up Food Bucks users who doubled up $17,716. And about a third of those individuals were coming from Omaha, so we have a lot of opportunity for growth. We're not going to have time today to dive into our violence prevention and intervention work, but know that this is also a substantive body of work, and we invite your partnership and your questions around these things if this is of interest to you today. And then I just wanted to be responsive to, I really appreciated my colleagues' presentations last month in talking about all of the partnerships that we've forged, because we recognize that we cannot do this work alone. So this list represents really substantive collaboration in the pursuit of meaningfully impacting the areas I just described. That concludes my presentation. We invite you to check out our community benefit reports at chihealth.com/community benefit. Those have been provided to you there. You can also see our implementation strategy plans at chihealth.com.